Hi, I'm Matt McNair, President of the OHSU Foundation. Thank you for joining us today for this virtual presentation from the OHSU Casey Eye Institute. I think most of us today would agree that before COVID-19 hit, we were already spending a lot of time on screens. Even with the hope of more in-person gatherings soon, the amount that we look at screens seems unlikely to significantly decrease. So we started wondering about things like how all that screen time will affect our eyes, both for kids and for adults. For example, are we getting more nearsighted the more we squint at screens? And what can be done about it? The good news is that there are things that you can do to keep your eyes healthy. And many eye care experts from the Casey Eye Institute will be sharing some of those tips and the most recent research here today. This presentation will also highlight the important work that Casey is doing to provide care for communities throughout the state, including a brief video from our community eye clinic that recently traveled to Woodburn, Oregon. And with that, I would like to introduce Dr. Dave Wilson, the Paul H. Casey Chair of Ophthalmology at the OHSU Casey Eye Institute. Thank you.
Thanks, Matt, and thanks to all the viewers joining us now to hear what has been happening at the Casey Eye Institute. Progress in medical care has been the result of three major advances: surgery, pharmaceutical agents, and imaging. Remarkably, these same areas have been the theme of innovative advances from the Casey Eye Institute. The first advance was surgery. When one thinks of surgery, the mental image is generally one of scalpels, scissors, and sutures. But now we are operating at the molecular level. Last year, a Casey team performed the first in the world DNA editing procedure on a patient with a form of retinitis pigmentosa. Just think of that. We are no longer excising visible tissue, but selectively removing abnormal molecules from a patient's DNA and replacing these molecules with the correct ones. We are just as likely to use a laser to cut or vaporize tissue as a scalpel or scissor. These advances have transformed surgery so that now almost all of our cases are outpatient and nearly pain-free. The next advance was pharmaceutical agents. Several years ago, it would have been inconceivable that we would purposefully inject medications into a patient's eye. Now, that is exactly what we do, thousands of times a year, with great benefit for patients with macular degeneration and diabetes, two of the leading causes of blindness in the U.S. In fact, Casey was one of 3 centers that performed the first trial of these agents, demonstrating their remarkable efficacy. These advances are the result of carefully designed clinical trials, and recognizing the importance of such trials, the new Elks Children's Eye Clinic and Wold Macular Degeneration Center have a state-of-the-art clinical trial center to expand our ability to investigate new treatments. And finally, imaging. It would be difficult for any of us to imagine the practice of medicine without X-rays, CTs, or MRIs. The analogous imaging for ophthalmology is OCT, or optical coherence tomography. The best CT or MRI scans have a resolution of about 3 millimeters. Pretty good. But OCT resolves 1,000 times smaller structures. Also, OCT images are obtained so quickly that they can be used to image the fine blood vessels within the eye. This lets us visualize the small capillary and other cellular changes that occur in diabetes, macular degeneration, and glaucoma. Early detection of these changes is a big step forward in preventing blindness. This past year, Casey faculty member David Wong was recognized as the recipient of the Greenberg Prize for his role in inventing OCT and its impact on eliminating blindness. While surgical, pharmaceutical, and imaging advances hold the key to eliminating blindness, other tools are necessary as well, and these will also be keys to the delivery of sight-saving care. My colleagues are going to talk about these advances, which herald new ways to reach patients and include telehealth, informatics, and artificial intelligence. These disciplines will allow application of the above technologies to large populations through our community outreach. Dr. Marina Thomas is going to start off with an explanation of how telehealth was critical to caring for patients in the COVID pandemic. Dr. Thomas is an exceptional retinal surgeon and expert in macular degeneration.
Thank you, Dr. Wilson, for your kind introduction and for your guidance of our department during this past year. When the COVID-19 pandemic began, we needed to think out of the box to find ways to continue to care for our ophthalmology patients. Prior to the pandemic, ophthalmology was always thought to be a unique specialty in which we were dependent on our examination. We did not have reliable ways to obtain visual acuity and intraocular pressures from a distance. We relied heavily on imaging that was done in the clinic. Telehealth has since exploded since the pandemic began, and we have done our part in expanding access to care of our patients with telehealth visits at the Casey Eye Institute. Our comprehensive ophthalmology clinic alone has completed over 1,000 telehealth visits since June 2020. One way we have modified our ophthalmic care is through hybrid telehealth visits. During the pandemic, patients want to distance as much as possible and avoid waiting times at doctors' offices. In order to gain valuable information from patients, we created hybrid visits where a patient can see an ophthalmic technician for an in-person 10-minute visit to obtain visual acuity, intraocular pressure, and imaging. Then, 1 day to 1 week later, the patient has a virtual visit with their ophthalmologist who reviews the data and discusses a plan of treatment with the patient. Here's an example of one of these visits. A Casey comprehensive ophthalmologist in Astoria saw a patient with a macular hole and 20/80 visual acuity. A macular hole is a retinal condition where a patient can get a break in their central retina, and we want to be able to fix that so that their vision can improve. The patient was unable to travel to see me for a clinic visit due to transportation issues, and he was reluctant to get treatment because of the travel concerns. 3 days later, I did a virtual visit with him. We reviewed his imaging, discussed the risks and benefits of surgical treatment for him, and after visiting with me, he understood the importance of surgery to improve his vision long-term, and we booked surgery in Portland 3 weeks later. I met him before the surgery for an in-person exam, and his visual acuity result was 20/40 with a closed macular hole. We will continue to offer these hybrid telehealth visits to our patients so that we can provide care in different ways that will make our patients feel most safe. Another example of thinking outside of the box is a topic near and dear to my heart: home monitoring of eye disease. Patients use an at-home device to perform a routine test and transmit real-time data to a healthcare professional. Home monitoring leads to better patient outcomes, improved quality of care, and reduced healthcare costs. In ophthalmology, we use various methods of visual acuity testing at home, including phone apps and printed charts. And at Casey, we have completed studies to compare the efficacy of these different technologies. We also use various devices to monitor vision changes at home for diseases such as age-related macular degeneration and diabetic macular edema. These devices send alerts to their providers when a change in vision has occurred so that they can be seen for treatment as soon as possible to prevent vision loss. Teleophthalmology is a rapidly growing field, and we hope to continue giving our patients many options for their care here at the Casey Eye Institute. COVID-19 has affected all of our lives in many ways and has impacted eye health in many ways as well. I am proud to introduce my colleague, Dr. Richard Stutzman, an assistant professor of ophthalmology at OHSU and a cornea specialist at the Casey Eye Institute. He will be discussing COVID's impact on our eye health.
Thank you, Dr. Thomas, for sharing how the rise of telemedicine during the pandemic has increased access to care for so many. COVID-19 has certainly affected us all. These effects have been both personal as well as professional. We've all modified our lives during this pandemic, and we've all experienced new challenges that had not been seen before. As you have heard, telemedicine has taken a spotlight during this period of time. As a subspecialist in cornea and external diseases, there has been one area in which we have seen a very positive change. That is in laser vision correction, LASIK and PRK, for the treatment of nearsightedness, farsightedness, and astigmatism. The mask requirement has made it difficult for many wearing glasses to do so without them fogging. This results in a limitation on functions of daily living. As such, many have turned to LASIK or PRK to eliminate their need for glasses and improve their quality of life. The pandemic has also forced us to rely more heavily on our electronic devices. This has negatively impacted the eye health of many individuals. With the increase in screen time, both personal as well as professional, many have presented with complaints of dry eye and eye strain. Our increased use of devices reduces our blink response, and as such, the tear film on the surface of our eye is more readily evaporated. This results in a dry eye syndrome, which can be characterized by a myriad of symptoms: blurring of vision, red eyes, and a sense that there is dirt, sand, or gravel in the eye. Realizing our dependence on these devices to complete our required tasks, there are several simple things we can do to reduce potential dysfunction. We can take frequent breaks from our devices. We can consciously remind ourselves to blink. We can augment our tear film with the addition of artificial lubricants, such as tears, gels, and nighttime ointments. Finally, with increased screen time, many are advocating the use of blue blocker glasses. Do they work? The short of the answer is no, not for your ocular health at least. However, before you throw away those blue blockers, understand that they do offer more of a benefit for maintaining your normal circadian rhythm, so they may improve your sleep cycle. This could certainly be an advantage. The pandemic has been felt globally, across all populations, across all ages. We are acutely aware of the impact that this has had on our children. They have not been immune to the effects. With schools having most, if not all, of their curriculum online, and kids staying indoors during lockdowns, screens became a way of life. But studies have shown that all this time in front of devices may be causing an increase in nearsightedness in children. Dr. Douglas Frederick, a professor of ophthalmology at OHSU and the director of the new Elks Children Eye Clinic at Casey Eye Institute, he will speak specifically to how this is affecting kids and what the Casey Eye Institute is doing to help.
Thank you, Dr. Stutzman. As we have just heard, all of us at Casey Eye Institute faced incredible challenges these past 18 months, as we had to make certain that we would continue to provide eye care to those adults and children suffering from vision-threatening conditions. Fortunately, for the children of Oregon, for over 70 years, the physicians and staff at Casey Eye Institute have been focusing on the special needs of children, assisted by the incredible generosity of Oregon Elks, who have provided over $40 million in direct support that has funded research to prevent blindness associated with prematurity, facilitated vision screening for over 8,000 children throughout the state each year, and provide the most up-to-date care in the state-of-the-art clinical facility. Those 70 years of dedication to children's ocular health proved invaluable when, in March of 2020, we had to transition to a virtual care environment. It is hard enough to deliver care and advice over the phone or computer to an adult with an eye problem. Think about how much more difficult it is to provide that care to an infant or child who cannot yet read, let alone use a laptop. To solve that problem, my brilliant and innovative colleagues here at Casey Eye Institute developed a vision screening system that would allow parents to accurately measure the sharpness of their children's eyesight, allowing us to monitor progress in the treatment of vision-threatening conditions. When an in-office visit was required, we were fortunate to be able to provide care in our brand new, state-of-the-art Elks Children's Eye Clinic. Made possible by generous support from the Oregon Elks, this facility was designed with the needs of children and their families as the highest priority. It has enabled us to provide care safely and efficiently, sparing hundreds of children from vision loss. While the changes to our work and family life imposed by the COVID-19 pandemic have been rough on all of us, they have been especially challenging for children who have had to pivot to remote learning, often in an indoor setting. The consequences to our children's vision has been significant, as around the world we have seen an increase in the amount of myopia, commonly referred to as nearsightedness, that is a consequence of prolonged time on the computer and lack of opportunity to enjoy our typical outdoor lifestyles. Even before the pandemic, researchers have been documenting an alarming increase in the number of children who are becoming myopic at a younger age and developing higher degrees of myopia as they become adults. High myopia can lead to permanent loss of vision due to macular degeneration and retinal detachment. So this new epidemic of myopia may become one of the leading causes of vision loss around the world. There is strong evidence that children who spend more time participating in near work, such as looking at their smartphones, laptops, and books and computers, and those who spend more time indoors, have a higher risk of becoming myopic and developing higher amounts of myopia. At the Casey Eye Institute, we'll be investigating new treatments, such as the use of low-dose atropine and use of specialty contact lenses to slow the progression of myopia in our children and young adults. As life returns to our new normal, all of us will be closely monitoring the long-term effects of the past 18 months. But more importantly, we'll be looking to the future to discover new ways to preserve vision and restore vision once thought irretrievably lost. Working with Dr. Pete Campbell, we will be investigating new ways to care for premature infants whose vision is threatened by potentially blinding retinopathy of prematurity. Collaborating with our colleagues in the Genetic Eye Disease Unit, we will be delivering vision-restoring gene therapy to children and adults once thought doomed to blindness. And finally, working closely with the Elks, we will provide vision screening outreach to children geographically distant from our clinical facilities, enabling us to diagnose treatable conditions and prevent and reverse vision impairment when time is of the essence. Helping all of our children see clearly into the future is our mission, and we are grateful for all who have supported us in the past and who will support us in the future as we strive to reach that goal. Now, we'd like to share more about how we at the Casey Eye Institute provide care for communities around the state through unique outreach programs in which philanthropy plays a significant part. To describe these exciting programs, I'd like to introduce Dr. Mitch Brinks, Associate Professor of Ophthalmology and Director of Global and Domestic Outreach at Casey Eye Institute.
All right, thank you, Dr. Frederick. For over a decade, the Casey Eye Institute Community Outreach Program has been dedicated to addressing preventable blindness directly in our community. We've traveled over 36,000 miles across Oregon over the last 10 plus years and provided free vision exams for over 10,000 at-risk or underserved individuals. Yet, even with those efforts, in support of a network of over 70 community partner sites, what we really found is that although we prevented many cases of avoidable blindness, we've really found that there's a large unmet need out in the community. And we've really learned about what the community needs and what they want, and have been thinking about that for some time. In general, our conclusions come to the fact that we really need to provide access for people to receive care in their home community to save sight, improve their life, lower healthcare costs, and overcome the barriers to high quality eye care, especially for many in rural communities and others with barriers to accessing healthcare. Right now, less than half of the people in the community with glaucoma have been diagnosed and are under treatment. And many of those with diabetes don't access their preventive screening exams. And that's particularly tragic because those diseases, especially glaucoma, often provides no symptoms until it's late stages of care or late stages of the disease, when much of the damage has already occurred. And for diabetes as well, about 90 to 95% of the patients who lose vision in the U.S. Didn't need to do that. The care is there if they can just access the care. In fact, in the U.S., we estimate that blindness prevalence will increase between now and the year 2050. In fact, a recent recalculation review of data in the U.S. increases the prevalence of blindness in the U.S. from 4.2 million up to 7.1 million people. You can see from the slide there's a general arc of increasing vision loss and blindness. In fact, we estimate that over 80,000 to 120,000 people in Oregon suffer from vision loss right now, and some 20,000 people are suffering from diabetic retinopathy. So we thought, well, what can we do to respond to these challenges? It's a big challenge, and a lot of people have tried a lot of interventions, but the Casey is a unique place with really deep resources. So we stopped and reviewed our resources and thought how we could apply those as tools to the problem in Oregon. The goal, I think, the top goal would be best described as providing early detection of these diseases, getting them identified and into care, and develop the infrastructure in these remote sites to provide not only that early detection, but also ongoing disease monitoring without people having to travel to tertiary care centers like Portland on such a regular basis, because that can be a great burden to those folks. So we thought, well, what tools do we have at the Casey? Thought one, we had what I described earlier, over 10 years of strong collaborative work with 70 community sites in Oregon, and we've really learned how those places work and who there could be part of this team. In fact, we developed an Oregon Health Authority certified training program for community health workers to teach them how to do basic vision tests. As well, at the Casey, we have excellent faculty expertise in teleophthalmology, from retinopathy of prematurity and informatics. In fact, one of our recent leaders was just promoted to be the director of the National Eye Institute in Bethesda, Maryland, and his many colleagues and mentors are still here ready to apply their talent and expertise to this program. We also have world leaders in ophthalmic imaging research, artificial intelligence, and many other areas where if we could potentially, we thought, take this technology out to the areas where people are underserved or in need, use our teleophthalmology resources to bring that information to the university, and then provide that early detection and remote monitoring early, that would really be a real win. So we've begun the process of developing a broad network of vision centers within community health center sites across Oregon. And the first phase will be early detection or screening for eye disease among general community members. We're going to try to identify eye diseases across the gamut from glaucoma, macular degeneration, diabetic retinopathy, cataract, and other diseases as the main causes of blindness in the US. And then once that infrastructure is set up and developed and the kinks of information transfer and patient management are worked out, then we'll transition to a remote monitoring where, say, someone with macular degeneration who would otherwise have to travel to OHSU every 6 weeks could potentially stay at home and get remotely monitored until their case really required care from an expert at the Casey Eye Institute. So we're building a team of vision health screening technicians throughout Oregon, including registered nurses, medical assistants, and community health workers in collaboration with the Oregon Health Authority, Oregon State University, the Knight Cancer Institute, and others across the state in a real collaborative effort. Our Oregon Clinical and Translational Research Institute is providing what's called an evaluation team to interact and engage with all the people on all aspects of this whole statewide team and understand everybody's needs, priorities, and make sure their input is included into the design of the program. As well, it should be noted that OHSU's Department of Medical Informatics and Clinical Epidemiology is one of the top programs in the country. And while that program might not be as familiar as, say, an ophthalmology or orthopedic clinic or something along the standard medical divisions, those folks really help us bring that information back and forth efficiently with high fidelity in a reliable way where folks on OHSU's side and the field side can really engage in information exchange efficiently with a lot of confidence in the system. What we're doing, based on input from all these people, is to start general screening among adults 50 years and older, because that's when these major blinding eye diseases tend to occur. We'll start with a risk assessment questionnaire. Say if folks have a history of smoking or family history of eye disease, they might be at higher risk. We'll, of course, check their vision and check their eye pressure as a major determinant of glaucoma. And then again, we'll pull in the Casey really strengths in ophthalmic imaging, where we take 3D views, photos, and other kind of imaging data from the back of the eye to help us design the right technology to be in the field. And then that data will, again, be analyzed by our experts at OHSU. And folks who are identified with eye disease early with this really easy to access process will get a definitive exam where we find out, do they truly have eye disease or not, either by a local eye care provider or by the Casey mobile vehicle targeting those sites on a quarterly basis. We estimate that initially, and these are just initial estimates, we'll screen around 200 at-risk individuals per site per quarter, so 800 to maybe 1,000 folks per site per year, and then again provide confirmatory exams with the Casey mobile vehicle. Eventually, and we're in process now, we'll have a new Casey mobile vehicle able to provide treatment for these folks, because as we know, some folks just have very, very few resources to help them get care. And so this vehicle will be able to provide the kind of, bring that circle around to completion where these folks get all the care they need. We are starting this exciting project, hopefully in the fall of 2021. Of course, there's a few challenges and have been a few challenges with COVID and people's ability to engage, but our early pilot site should launch again in late 2021 in the North Portland area for a trial site, then move out to rural Oregon in winter of 2021 for a second site, and then on to 6 additional sites in Oregon over the following year with a long-term program that we expect could be a game changer for ophthalmology and kind of lead the way in terms of where this field should be or will be in the future. And with that, I'd like to hand the podium over to Varian Wedeking, who will show us our community outreach program and its impact on the community in person during a recent mobile eye clinic visit to the community of Woodburn, Oregon. Thank you.
Hey, good afternoon. My name is Varian Wedeking, and I'm the program director for the Casey Eye Community Outreach Program. And we're here in Woodburn, Oregon today with our mobile eye clinic and our volunteers in partnership with Yakima Valley Farm Workers Salute Clinic. Today, we're offering a comprehensive medical eye clinic to the community members here to help end preventable blindness. And I'm here to show you a little bit about our clinic today. All right, let's come along. As part of the Casey Eye mission to help eliminate preventable blindness, we provide a comprehensive medical eye exam to every participant that comes through our clinic. The participants are scheduled by our community partners in advance and are asked to identify individuals in their communities who experience access barriers to care. Come along with me while we see Dr. Wilson. Hey, and here we are with Dr. Dave Wilson, who is our volunteer physician today, and I'm going to have him tell you a little bit about what he's doing here today and why he volunteers.
So the way that the screening is set up is that the patients will be screened in the medical clinic that's our community partner, and then for their more comprehensive eye exam, they'll come on to the screening bin, and there we'll be able to do a full dilated examination and slit lamp examination, and that will let us detect diabetes and glaucoma, macular degeneration, and many other eye diseases that don't have any symptoms in their early stages. And that's when we want to detect it, because if we can detect it, then we can prevent vision loss, which is the most effective way to serve the population. So Varian and his group have really built up a wonderful group of partners in the community and lets us reach a very large population that often have limited access to this type of eye care. So really appreciate the donors providing this opportunity for us to serve the people in Oregon, and thanks to Varian, we're trying to get the job done.
And here we'll go ahead and observe Dr. Wilson performing an exam for a few moments.
Look at your eyes with a light here. It's pretty bright.
Va a revisar sus ojos, va a haber una luz, va a estar algo brillante, algo fuerte, pero
We're going to put your chin
su
here.
barbilla aquí y luego la frente que pegue muy bien.
Let's go inside and hear from one of our volunteers.
Hey everyone, my name is Austin Eagleman. I'm a volunteer here and a fourth-year medical student. This is my 5th year volunteering with Casey. It's been a lot of fun and been honestly one of the best parts of my medical school training here. So just wanted to show you, I'm doing the tech station so we can come see that. So in the tech station, what we do, we have the patient sit there and we check their eye movements and we check their pupils. We make sure their pressures are okay. And then we dilate them and we basically make sure that they're safe to go out onto the rig and see the doctor. And so it's a lot of fun. You can talk to the patients, you can really get to know them, and you really feel like you're making a difference. And I just want to say thanks to the donors. You guys are really the reason why we're able to do everything that we do. I know it's really been a big part of my time here at OHSU, and so thank you.
Thank you for joining us in Woodburn today. I love seeing our mobile clinic in action across the state of Oregon. Getting involved with Casey is a way to contribute to our mission of ending preventable blindness and providing eye care to everyone who needs it. Your support can help researchers revolutionize how we diagnose and treat eye conditions, provide vision for millions, and help continue outreach programs like this. Dr. Dave Wilson will close us out and talk a little more about how you can help. Thank you. Thanks, Varian, for that behind-the-scene look at the community outreach team in action. What incredible work you and the team are doing, as well as the impactful work shared by our presenters today. Thank you to this phenomenal team, and thank you to our viewers for joining this insightful update. These remarkable programs would not be possible without the generous support we have had from donors. In particular, the Oregon State Elks have been our generous partner for 70 years in delivering eye care to Oregon's children. Paul Casey and his family have helped us build perhaps the world's largest program in gene therapy for eye disease. The Wold family has established a macular degeneration center that is addressing the leading cause of blindness in the United States.
Doug and Joe Peterson have generously supported our clinical care in retinal disease. The Hart family and the Campbell family have provided generous support to our basic research efforts. And as we have stressed, community outreach will be a future game changer for medicine. We truly appreciate the support of the Roundhouse Foundation and Heather Kelo for supporting our expanded activity in this area. Before we close, we would like to hear your feedback on today's presentation. On the screen, you will see a link to our quick survey. Additionally, if you would like to learn more about how you can support the work happening at the Casey Eye Institute, please share your name and contact information via the survey, and a member of our team will follow up with you. With that, this concludes our presentation today. Thank you for joining us, and have a wonderful day.